Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. Before we get started, I want to talk about insurance and some other issues. But before we do, down below in the YouTube description box will be a link to the Healthcare Advocacy newsletter that is the text for today's video. It has all the reference material I mentioned and actions and medical journal links, all kinds of stuff, as well as some healthcare links, things you can do in case your claim is denied or if you need abortion access or whatnot. Anyway, let's get started. I want to talk about slow-rolling human behavior, especially as it applies to insurance. Now, it's not uncommon for people to delay taking action when they don't want to take action. I attended a meeting this week with the Universal Healthcare Commission head, with the person in charge of that commission in Washington State. That commission has been tasked with designing a universal healthcare system for all Washingtonians. Essentially, they're supposed to come up with a way that the state can make sure that everybody can go to the doctor. Ideally, it should be a single-payer healthcare system run by the state of Washington. I'm sure that these people are all very nice, but they are not motivated to do anything, and they have spent years producing nothing of value and have made essentially no progress towards getting everyone in the state covered. And I will point out that there are actually 455,000 people in my state who have no health insurance, no Medicaid, no employer-sponsored plan, no ACA plan, no nothing. And so there's a real need in our state. It's actually in every state. But Washington citizens said they wanted to do it. This bunch of people is just making it hard. Well, here's a story from New Orleans, Louisiana. St. Charles Surgical Hospital and Center for Restorative Breast Surgery is a privately owned surgical facility, and it is known as a specialist in rebuilding the breasts of cancer patients. They're actually very innovative, and they are literally the top of the food chain. They have had a lawsuit against Blue Cross of Louisiana for about 7 years because they haven't been paid. This week, though, they won their case, having convinced a jury in Orleans Parish Civil District Court that Blue Cross committed fraud when it authorized, get this, 7,800 surgeries from 2015 to 2023, and then only paid about 9% of the bills. Talk about slow rolling the payments. The jury looked at this. They took 2 hours to come up with a verdict. This was extreme slow rolling. Anyway, the hospital said they're going to use the funds to just clear out the patient's accounts because that was the point. Part of this was retribution by the insurance company against the surgery center because they dropped out of the Blue Cross network. Now remember, insurance companies create these networks and then try to offer discounted payments to them with the hope of providing a volume of patients. So we'll pay you less per patient, but you'll get more patients. Hold that network thought. I'm going to come back to it. The U.S. healthcare system is in a race to the bottom. This is not a joke. The healthcare provided in the United States is a very mixed bag. We have some of the greatest innovations and discoveries, and they are often unavailable to millions. The Commonwealth Fund just released their assessment of healthcare country by country, and we are not doing well. Of course, there's a link to it in the newsletter. The report covers 10 industrialized peer nations of ours, and it also accounts, this is new, it accounts for the impact of COVID-19 on everybody's health system. The report compared access to healthcare between residents with above average and below average income. It also considered how well the systems performed for men and for women, rural and non-rural settings. And I include a link to the methodology they used. I include some tables in the newsletter. You can look at them, but pretty much the U.S. is at the bottom. I mean, the absolute bottom. And of course, this should be no surprise, we pay about twice as much as a nation than any of those other 9 countries. We do lead the pack, though, in barriers to accessing care. Isn't that charming? Okay, we do well in one area. Not rated number 1, we were rated number 2. It's what's called care process. Now, one possible explanation for the good rating in care process, that is, once you get into the doctor, there is a defined process that people have to follow, is that we have very vigorous pay for performance or value-based care efforts that private and public payers in the United States have undertaken in recent years. A lot of this comes from the Affordable Care Act, when they defined what preventive care has to look like. If you happen to have Medicare, they call you in once a year for an exam. It's that same defined process of preventive care. So who else does this? Who else follows this? Well, managed care systems do that. Medicaid uses this. Accountable care organizations that Medicare is trying to force on its enrollees. HMOs do this. They all follow this sort of defined process, and that's great. They may have succeeded in increasing system-wide conformance to guidelines for preventive services, and that's good, but despite comparatively high performance on care process, health outcomes, including things like life expectancy, treatable and preventable deaths, the US is the worst of the 10 countries in the analysis. So that's great, we're getting nice preventive care, but we're not living longer and we're dying way sooner than we have to from things that are preventable and treatable. So we're not getting the care to everybody who needs it. So managed care, it doesn't look like that's really the answer. Anyway, I have been reading these Commonwealth Fund reports for years, and the results always seem to have the same sound. We're innovative, but our population does not have access, and we waste half of our money not providing care to tens of millions of us. Every other country in the report found a way to cover everybody. Some do it with a public insurance trust, like a single-payer national insurance trust. Some do it with nonprofit insurance trusts that are actually set up by nonprofit organizations. Some use commercial insurance to offer certain nonprofit insurance products and then have optional for-product insurance on top. Some systems have co-pays, really important in France. Some don't, like England. No copay in England, but everybody is covered. There are cultural differences to make it work, but everybody is covered. Not here. Well, there is an answer, and it is to have a universal healthcare system that covers all of us. And let's take an action to remind those we elected that we deserve way better than this. Let's let our elected representatives know we deserve a healthcare system that really works for all of us. If you want to call or email, I'll have a link to a site where you can get their phone number or email address, or you can use RESISTBOT on your cell phone. It's real simple. Just send a text message, sign, SIGN, space, PJQISD, sign PJQISD to 50409. Here's the message that you'll send. The Commonwealth Fund just released their review of healthcare in 10 industrialized nations, and we are dead last. Now, while we've become more standardized on what preventive care is, we have tens of millions without access to healthcare. We have medical bankruptcies, we pay twice as much as other countries, and we don't get what they get, access to a doctor and longer life expectancy. We need universal healthcare, and you know it. We pay $400 billion too much every year in overhead costs. That's per the Congressional Budget Office. Insurance companies delay, deny, and slow roll payments. Medical networks that get capitulation payments like Medicare Advantage and managed accountable care organizations, Medicare accountable care organizations, managed care groups, and insurance networks, they keep what they don't spend on care, and we get less care. Look, I want you to pass universal health care and stop setting your constituents up to be cheated by insurance companies and medical networks. Enough. Get H.R. 3421, the vastly improved Medicare for All Act, to a vote. And I've included a link for you in this email so you and your legislative staff can read it. Thank you. Now, that's what I've got for you. And down below, you can like, share, and subscribe. Send me comments here in the YouTube description area, or send them to healthcareadvocacy1@gmail.com. I do work on reports that people send requests for. I've done prison healthcare reports. I'm doing one right now on Medicare ACO REACH for one of the readers, and I hope you find this useful. Let me know. Have a good evening.